Good evening, everyone. We will get started here in a few minutes. Good evening, everyone. We will get started here in a few minutes. Thank you for joining us. Just maybe about one more minute while people are assembling. Good evening, everyone, and thank you so much for joining us tonight. Welcome to tonight's webinar on navigating RSV to help protect the health of our babies. My name is Leslie Garcia Fontenot, and I'm the VP Managing Director at Black Health Matters. We are a leading voice and advocate in the health and wellness space with a mission to empower and educate our community on critical health issues, bridging the gap in healthcare and information for African Americans. One such issue is respiratory syncytial virus, or what's commonly known as RSV. This common virus can be especially dangerous for infants. In fact, studies show that African American infants may be at higher risk of severe RSV-related complications due to factors like higher prematurity rates, delayed diagnosis, and limited healthcare access. With this webinar, our goal is to raise awareness, share valuable information, and also equip parents and caregivers with the tools to protect their little ones. I'd like to thank our sponsor, Sanofi, for their commitment to educating the community about this important topic. We're also delighted to be in the company of some incredible panel of speakers who will provide insights into RSV and share their experiences. First up, I'm excited to introduce you to Charzelle, who is joining us to share her family's RSV journey and is being compensated for sharing her story. Charzelle, it's an honor to have you here, and we appreciate you taking the time out of your schedule to share your experiences with us. Let's start out by learning a little more about you. So can you please tell us about yourself and tell the audience as well? Yep.
Hi, again, my name is Charzelle. I am a family of four. My husband and I have been married for almost 5 years. We 5 years make 5 years in January. He's currently in the military, and I served 3 years as well. We have a baby boy. His name's Aiden. He just turned 4, and we have a sweet 2-year-old giving us a run, and her name is Ayani. I am currently working as a patient care technician. I will be going to school here soon to start my BSN. And I'm actually might be starting another job. So as you can see, I have a full schedule. I'm currently a full-time mom, going back to be a full-time student, and working a full-time job. And I like to describe us as a pretty typical family where both of the parents work, the kids are in daycare, and we just spend time with them when we get the chance to. It's not what I prefer, but we're doing the best we can. So, we do the typical scheduled dinner, bath, bed, wake up and do it all over again.
Leslie, I believe you're muted.
I'm sorry there. Thank you so much, Charzelle, for sharing your story. And also, you have such a busy schedule. I don't know how you actually are able to to even take care of the four kids. You're a student and a full-time mom. Um, and your experience with RSV, I mean, I can't even imagine how you were able to manage that. Can you tell us a little bit more about that?
I have two kids, and with my first, I attended a class in with the military, and they allowed someone to come to my home, and we sat and discussed like the different things that happen or to look out for during the different trimesters in pregnancy. And then towards the end, we talked about what to expect with a newborn. Now, as far as my second daughter, I kind of figured I had everything down pat. I knew everything I needed to know, even though parenting doesn't come with the guidebook.
Mhm.
um, and RSV just was not one thing that was discussed with my first child. Um, Not something I really looked forward to seeing or hearing about. Didn't know too much about it until my daughter got RSV.
I know that had to be very, very tough for you. Um, how was she diagnosed? What were some of the experiences that you had in working with her?
So,
How did you know it was
she was
RSV?
premature. She was born at 29 weeks and 4 days.
Mhm.
And already having a hard pregnancy with her, hard delivery, and then her spending time in the NICU. We pretty much just watched for any and everything that was wrong. And during the time that she was in the NICU, she also had respiratory problems,
Mhm.
where she actually was resuscitated twice.
Oh my gosh.
So after that, we kind of really just paid attention to any and everything she did. And we went home to visit family, and we didn't want too many little ones to be around because we knew she just got home from the hospital, wasn't really immune to being around too many people. But we just kind of just took the chance just so the family could meet her. It had already been rough. We just wanted to be around love and comfort. So my niece was around and she was coughing, but it wasn't like anything like to look out for. It was just kind of a normal cough. Didn't think too much of it. And one day I had went out to just run some errands and my mom called me like, "Hey, Um, Ayani, having a hard time breathing. She's like choking on mucus in her spit. I think she needs to go to the hospital. And on my way there to go and grab her from the house, I was just like so scared. I was just in a panic. Like I didn't know what to think. I didn't know what to do. Um, it was just like this is going back to us being in the hospital. Like it's just a total shock. And once I got there, like I had my sister ride with me because I couldn't put her in her car seat. I was just way too scared. I was scared to go alone. I didn't want to lose her again. So once we made it to the hospital, they pretty much just suctioned her out. They tested her for a few different things, like I think like the flu and COVID. But once they suctioned her out, they kind of just like, well, her test came back negative. Not really like her O2 was good. It's not much that really needs to be done. Um, so then we went home. I want to say maybe like the fourth, fifth day, it just seemed like she just could not sleep at all. She would wake up almost like every hour on the hour. And then she was again coughing and choking. So that's when we took her back to the hospital and they retested her for those same things. But this time they actually tested her for RSV. And that's when RSV came back positive. And at that time, I knew nothing about RSV. I had seen Facebook stories about it, but at that time, like she wasn't sick, so I didn't really look into it. Um, and after they got diagnosed from the hospital, it was kind of like they kind of just gave us like the little information pamphlet they give you and kind of sent us home. Um, so I again didn't know too much about it. So I just kind of tried to just treat her as if like it was just like I guess like a normal sickness. Like we used a humidifier. We gave her something for the cough, but we basically just had to wait it out. But it just to me it was just kind of hard and it sucked because the hospital really didn't tell me what to do. And like at that time, this is only my second child. My son had never been through it, and I was just lost, confused. But I just tried what I could, and eventually she got better.
That's incredible. Oh my God. They had to be so scary, and you had another child already that you had to also take care of and protect, and then also deal with this illness. So what can you tell us in terms of, in terms of the signs and also just being more aware and for other parents that are out there that are not really aware about it? We know that early diagnosis is important and being proactive. What would be some of your suggestions for a mother that has an infant and starts to see some signs of things? How should they handle it?
Um, Since RSV is to me kind of like it starts off as other sicknesses, I
Mhm.
would you really can't watch for anything with RSV simply because again, they're like the same sicknesses as um you have the same symptoms as other sicknesses.
Mhm.
So for me, I just go to the hospital regardless of what it is. They have a cough, they have a runny nose. I just go to the hospital. That's because they can rule out whatever it is. I'd rather be safe than sorry.
No, that definitely makes sense. Did you have a pediatrician also that you had worked with or anyone of that nature that could give you some advice?
She did have a follow up with a ped. He was not her normal ped, but again, they didn't really. It was more so just to check her, make sure she's okay. Not really again talk too much about RSV.
Hmm. And then in terms of your other children, they were all okay.
Yes, we tried to keep them as far as apart as we could. Make
Hmm.
sure they weren't in each other's faces. Kind of kept
Yes.
the baby isolated, didn't want her around anybody else. Didn't need anyone else getting sick.
Well, thank you. Is there anything else you wanted to add before we um, talk to Dr. Weiss here in terms of any advice you can give a new parent? Mhm.
Um, I like to share my story because I simply know that there is at least one person out there that does not know what RSV is or what to look for. And um, they can just be in a position that I'm in and not know anything. So I hope that me learning and giving my experience can help another family.
Yeah, and I think, with this season and everything that's going around, do you think that it would be good for parents to actually reach out and we could talk about this some more with Dr. Weiss as well and check with their pediatrician and learn more about RSV?
I would definitely write down any question that you have, and don't just take it to one person. Take, ask us. Take it to your ped. Maybe the next time you're in the hospital, ask the doctor. Because I feel like everybody knows what strep is, everybody knows what COVID is, but not too many people know what RSV is. It's just kind of something that's in the background. It's not really upfront like those other sicknesses are.
Hmm.
And
Definitely.
being new parents, it can be serious. RSV can be a life or death thing.
Right. Well, thank you so much for sharing your story. I mean, I can't imagine having had gone through this, even though I have children myself, they're grown, but it's just such a scary feeling when you don't know what's going on with an infant. But thank you so much for sharing. So,
Thank you.
thank you. Next up, we have Dr. Jasmine Weiss, who will be speaking with us about her knowledge on RSV and sharing more information about this with parents and caregivers. I'm going to share a little bit of background on Dr. Weiss here. Dr. Jasmine Weiss is a board certified pediatrician, and she's also the assistant professor at UNC Chapel Hill School of Medicine in the Department of Pediatrics. She completed her fellowship in the National Clinician Scholar Program at Yale School of Medicine in 2021, and she's also the CEO and founder of Black Med Connect and is the host of Black Med Connect podcast. So please look out for it. Is that on which platform?
Yes, it's on all platforms.
Okay, great. Dr. Rice received her undergraduate degree in biology pre-medicine from Florida A&M, graduating summa cum laude, and her doctorate of medicine from Duke University School of Medicine. She served as a chief resident at Emory Pediatrics Residency Program, and during that pediatric residency, she served as founding resident diversity committee chairperson and as the American Academy of Pediatrics national representative for that program. She's also the recipient of the Anne Jacques Excellence in Primary Care Award and the Resident of the Year Award. Her career interests include serving her community as an academic pediatrician and finding innovative strategies to promote diversity, equity, and inclusion in medical education and the healthcare workforce. For her efforts, she was recently honored as a top healthcare professional under 40 by the National Medical Association. We knew you looked young for a reason. So you definitely have wonderful credentials, and we're so excited to hear your presentation. Thank you, Dr.
Thank you so much.
Mhm.
Thank you so much. And I'm delighted to be here this evening. And thank you to Charzelle for sharing her story about what she went through as a parent. And I'm here to just bring more awareness to this very scary infection called RSV. And I'd like to make sure we get to address and answer your questions also as we go along. So be sure if you think of any questions, keep them in mind, write them down, put it in the chat, and we can answer those as well. So our goal here is to think about how we can help protect our babies and to share what you need to know about RSV, because as Charzelle mentioned, so many families don't know about the virus and until it's a time where it's very serious. So tonight we want to shed some more light on that. So I want to first start with the fact that RSV is a type of viral illness, a type of viral upper respiratory infection. And so, even as Charles already mentioned, it can look like a lot of other viruses. And so, what a virus is very, very common. It affects the upper portion of a baby's respiratory system. And there's tiny, tiny germs that infect various cells within the respiratory system. So it can start at the nose and move all the way down to the throat. It can be in the sinuses, and it can go down into the lower respiratory tract and down into the lungs as well. So I want to make sure to highlight here that not each time a baby has a cold or a viral upper respiratory infection is it actually the RSV virus that's causing the infection. As some may know, there are so many viruses, but RSV is a critical one, especially for babies within their first year of life. So we're going to talk a lot in more detail specifically about RSV. So RSV stands for respiratory syncytial virus. And this is a very important fact. 2 out of 3 babies will get RSV by age 1. So it's very, very common. And it doesn't always mean that they'll have the most severe case, but 2 out of 3 babies still may have the virus by age 1. It is very, very contagious according to the CDC, and it can lead to very, very serious illnesses for babies, especially under age 1. RSV is the leading cause of hospitalization for babies yet less than a year old. And I like to share with families when I was in my residency training, if you were to go into the hospital anytime in these winter months from November all the way till about March or so, all the doors will have the little precautions for viruses, respiratory precautions. So all of the doctors, any team member has to put their gowns and gloves and masks on, and we come in looking like yellow people. But almost every door at that time of the year is a baby or a child with a viral illness. And so it's very, very important to know what the signs and symptoms are, so that if you start to see those symptoms in your child, you can talk to your pediatrician or your healthcare professional and make sure they are evaluated. And so RSV is unpredictable. Out of the hospitalizations in a year, 1,176 of those may be hospitalizations for RSV if there's a baby that's under age 1. But not all the time, as I mentioned before, are those symptoms necessarily caused by RSV. And in this particular study, there were 851 patients that there was no reported cause. So they weren't able to identify the actual virus that was causing the illness. And so I want to also look at this particular graph, because here you may notice that prematurity in children is also a very big risk factor for having RSV and having more severe cases of RSV. And one thing we know that African-American babies are more likely to be born prematurely. So our rate of preterm birth is higher. So that automatically kind of puts babies in a category of having being premature, also leading to increased risk of RSV. So let's talk a bit about the signs and symptoms. So as stated before, RSV can look like any other cold. It can start with runny nose, decreased appetite, coughing, sneezing, fevers, and even wheezing. But this tends to occur in stages. So the first few days, maybe day 1 to day 3, a child may only have the runny nose, a little bit of cough, maybe a little bit more fussy. But as we progress along, that's when symptoms can become worse and worse over time. So days 3 to 5, that's when the fevers can get worse, the cough can progress, the mucus can progress, and even the difficulty breathing. So now babies may be extremely fussy. You may be suctioning them a lot. They may be having difficulty breathing. And those are the signs, and that's the time absolutely to seek medical care and to have your child evaluated if you notice these symptoms. Now, if you notice these symptoms, things can progress from day 5 to 7, even to the peak of being worse in that time period. So this is when you see times where children may need to be hospitalized. They may require oxygen support. They may require other supportive therapy, such as suctioning more frequently, IV fluids if they're dehydrated. And that day 5 to 7 is typically when things peak for this illness. After that period of time, moving into typically start to see symptoms improving over time and gradually getting better and better. But when I see families in the office, I like to tell them, if your child's had a viral illness such as RSV, the cough may linger for weeks, because that is a huge question that I tend to get each time I'm in the clinic seeing patients. How long is this cough going to last? Dr. Weiss, Dr. Jazz, how long are we going to deal with this cough? And truly, it can last for an additional 2 weeks up to 3 weeks. So it gradually will get better, but lungs do have to heal up over time. And so that's the typical course of illness. And I want to impress on everyone that if you notice your child starting to have difficulty breathing or not being able to eat as much as usual or not actually urinating as much as usual, those are all reasons to seek medical attention and have your child evaluated. So this is a question we get a lot. So what is the treatment for RSV? And unfortunately, there is no treatment that specifically we can give that'll stop RSV in its tracks and be curative for a baby who may have the virus. So what we do, as Charzelle even mentioned before, is all about supportive care. And so we're giving the babies time for their bodies to build up their immunity with the virus and to have an immune response that eventually causes the symptoms to subside and calm down and get better. But in the meantime, we do everything we need to, such as if a baby's not tolerating their breast milk or formula, we will provide IV fluids if they're hospitalized. Because RSV can really impact their lungs, if we notice that their oxygen levels are not at the appropriate levels, we'll provide oxygen therapy. If we find that they're having so much mucus, we can do suctioning very frequently to make sure we can help the babies kind of breathe and start to feed on their own. So we're doing all the things to support them during that time where the illness can peak, including the supportive care with fever-reducing medications to make sure that we're supporting them if they have fevers. And so those are the main ways that we help when a baby is diagnosed with RSV in the hospital. And if a child is diagnosed with RSV but is not severe enough to need hospitalization, the same thing applies at home. We would let families know if the fever ever gets to be greater than 100.4 degrees Fahrenheit, that's when you would give your medications for fever based on the baby's weight. If they are struggling with feeds at home, we always recommend to suction them out first with, they have the devices that you can, the ones that everybody knows of, the bulb suctions that you can suck the mucus out, but there are also devices that are much stronger that you can use to actually hook the device up to you and suck the mucus out. I know it's very gross, but it's very effective. Those types of devices can be used when a baby may have a viral illness such as RSV at home. And we often recommend that families suction a baby before the feedings and before laying them down for naps or for bed, just to try to support them, knowing that the mucus is kind of the hardest part to deal with in terms of them being able to swallow, breathe, eat, do all those things in a coordinated manner. And then, of course, warning signs are if you notice your child is having their ribs sucking in and out, or their nose is flaring in and out, or even at the neck, if you see that moving in and out with breathing, that combination means they're really working hard to breathe. So even if I, as a pediatrician, may say it's safe to go home today, but if you see those symptoms start to occur, you need to seek medical attention. So some tips to help prevent RSV in babies. It's all about hand washing, right? As often as you can, making sure your hands are clean, making sure that if you have other children at home, This is something that I commonly get asked about, like, should we separate them? That's very hard to do. Every family is different. You may not have the space to do that, but definitely making sure to clean and disinfect surfaces, making sure you clean toys, not sharing utensils, and ultimately avoiding close contact with anyone else who has cold symptoms. So if you know someone with a cold, it may not be the best time for them to be around your baby, especially making sure that they don't necessarily touch the baby or aren't kissing the baby, because those are the ways in which RSV can spread. So close contact, spreading the droplets from one person to another, or sharing toys and utensils are the ways in which this can spread. Of course, using proper hygiene with covering your face when coughing or sneezing, and as I said before, avoiding sharing utensils if someone has symptoms of an illness. So I will stop there.
Thank you. Oh my gosh, so much information and so much important information. And I have a few questions, but I also see we have questions from the audience. One area that you talked about in terms of RSV and actually preventing it and knowing the signs. Sometimes just what we know in terms of parents, and you get really, really busy, and you may not be able to see these signs, and knowing that you may be, if you go to the hospital, they may send you back home, just like what Charzelle went through. What do you suggest for parents that have some time constraints with dealing with doctors and all of that? Like, what's the first sign that would allow someone to say, hey, I need to get my child to a hospital right now, um, as opposed to waiting until, it's really, really bad? When will they actually take them if they don't have a primary care or a pediatrician that they can see right away?
Mhm. So that's a great question. I think it's important if you ever are concerned, right? My motto as a pediatrician is the hospital is always there 24 hours a day, 7 days a week. So there's no wrong answer for when you go to the hospital if you feel like you're worried about your baby. With that being said, if you do have a pediatrician, we always have a hotline available. You can call into the clinic and you can talk about the symptoms, and someone can help you decide whether it's safe for you to see us in the morning, or if you should come in if it's during the day and we have an appointment, or even we have a walk-in clinic, right? You can come in at any point. But I understand every clinic is different about that. And
Mm-hmm.
so if you do have a primary care provider, I always suggest making that phone call unless you feel like it's an emergency and you want to call 911 or either go straight to the hospital.
And they should see you. And how, if someone comes in and they don't have the primary care and they just get
Mhm,
into the hospital, they see them right away? It's because it's an infant. I know you don't work in every hospital,
mhm,
but
mhm,
seems like that might be a barrier for many mothers.
mhm. That's a great question. So triaging in the emergency room is a little bit of a different kind of
Mm-hmm.
way that that's organized. I will say though, if someone comes in with difficulty breathing and they check their vital signs, especially a baby, if that oxygen level is low, they're going to move swiftly. Like that's the
Okay.
goal. So there are certain things that trigger um, the severity level when you're in the emergency room. And the more severe you are, they're moving much faster. And if they can kind of put you in a category of we need to see you, but not as severely as we need to see someone else, you may have to wait a little bit longer. I will say this though, when you're waiting in the emergency room, you are waiting next to people who are also sick, right? And so
Right.
that's true for the emergency room. That's true
Anything.
for the pediatric clinic you may go to. So just bear in mind that, that waiting time, you always have to manage who's around and if individuals are coughing and thus and so.
And that makes sense. Charzelle, did you have anything you want to add into? Because I know you actually said that you go to the hospital. Great. You went to the hospital several times and you actually had to kind of wait it out. Um, what would you suggest to a mother that actually, what did you do when you had to go in the hospital and you had, or to the emergency room and you had to wait there with your child? How did you protect her?
Actually, during the first visit of the hospital, she was kind of seen right away. There wasn't too many people in there
Okay.
at that time. But once they checked her, like they did like the pre-check-in before you
Mhm.
got sent to the back, once they checked her oxygen levels, we did kind of sit and wait. I kind of just held her. I mean, there wasn't really much I could do. I wasn't leaving without them saying at least something. So just had to wait before we were able to be seen in the back.
Great, great. So we have a few questions, and we also, while we're pulling up the questions, also wanted to share some resources in our survey to make sure that we have everyone capturing the survey as well as the resources. So I'll pull up some questions. We can also on screen share the survey here, QR code. But I also want to make a point to share the resources that we have for parents as well. So if everyone can see the screen here, you'll see that there's several different organizations that provide resources and support for parents of infants. There's the Black Child Development Institute. There's the National Coalition of Infant Health, as well as Mocha Moms. So please capture, do a screen share. And there's also, of course, our sponsor, Sanofi. Their website is protectagainstrsv.com to learn more. At this point, I will call out a couple of the questions or go to the Q&A. So it says, since babies can catch RSV from family members or siblings, is it identified as RSV in children, teens, and adults? That's a great question, Dr. Weiss.
Yes, so that's a great question. So basically, a nasal swab is the test that's typically used to identify the types of viruses that we may be looking for. It depends on what your provider may order, but RSV is one of the viral components that are typically on those tests that are done. And so it can be that a baby may have RSV, a child, a teenager, any age group can have RSV, including, the elderly population as well. So it's not, we do see severity peaks in different parts of life. So early in life and then later in life, but it doesn't mean that you can't have the viral illness at any age in life.
Great, thank you for that. There's another question here. Can you please talk about the importance of breastfeeding? It literally saved my daughter's life and helped her round of RSV easier for her.
Mhm. Excellent. The parent who wrote that or the person who wrote that brings up an excellent point. So breastfeeding has been shown to reduce the severity of RSV infections in babies. Typically because breast milk has some level of passive immunity. So some of the chemicals, I won't get too detailed, called IgA, immunoglobulin A, but those chemicals help pass immunity from mom to the baby and can help reduce the severity of most viral illnesses, including RSV. It can also help with a variety of things, reducing risks of severe eczema, ear infections, all kinds of things. So breastfeeding is the way to go if possible for families. We know and recognize it's not easy and it's not always possible for mothers, especially working moms who may or may not have the opportunity and the location and all of that they need to breastfeed daily, but it is the best thing you can do for your baby in terms of helping to reduce the severity if a patient does or a baby does develop RSV.
That's a great one. And then also, please talk about the ways to advocate for your baby with testing.
Ooh, that's a good one. You have to ask. I am a huge advocate for if you are a mother, father, grandmother, auntie, uncle, doesn't matter who you are. If you're bringing the baby in, ask for what you need, ask for what you want. And you're going to get some doctors that may say, well, we don't think it's necessary, but put the ownership on the doctor to explain to you why they don't think it's necessary. You should always ask the questions. I have families who write down questions and we go one by one. And now if I feel strongly as the position that they may not need something, I should be able to explain that and help them be reassured by that. But at the end of the day, if a family asks me, I hear what you're saying, but could you please do it for my peace of mind? I'm the type of doctor that I'm going to do that, because peace of mind to me is just as important as the testing that we do or don't do.
That's an excellent answer and a great question. So here's another question we have from a viewer. What are your thoughts on getting the maternal RSV vaccine or the infant and bodies as preventative measures? So basically they're just asking, what do you think about getting the RSV vaccine?
I think that's a great thing to do. So moms who are pregnant can get the vaccine during pregnancy. I do recommend that. And I also recommend for babies in the first 8 months of their life, if they're in this respiratory season, that we do recommend that they get the antibodies that are available to help prevent the infections.
Great, that's great. One person asked about RSV only occurring in children. We know that it's in adults as well. Our session is focused on infants and children today. Let me just see, I'm going through the list of questions here. Answered. Let's see here.
May I ask, Charzelle, I'm gonna ask you a question about, do you feel like your voice is heard when you advocated for your child? Because I know everybody has different experiences.
My first hospital visit, no, but at the same time, I did not really ask too many questions. I was just way too scared, way too in shock. But that second time around, I'm like, this is my baby. She cannot talk for herself. I know there's something wrong with her. She needs all the help she can get.
Yeah,
Again,
but
like I said, they didn't do too much to help her, but I mean, that's just just doctors
Mm.
around the world.
yeah, it's one of those things that thank goodness that you didn't give up, Charzelle. You just kept going back and asking. And that's one of the things that we know across all disease states, but especially when you're dealing with an infant as well, that you really have to advocate for your child if you see anything. There's one here that's interesting. Is there any difference in rates of infection between genders?
Not that I don't think there's been any studies that indicate difference based on gender. It's more, there have been studies that show premature versus babies born on time. That's a big one. That's babies that have chronic infections, that's a higher risk, or chronic illnesses, heart conditions, they're at higher risk, but nothing based on gender specifically.
Okay, well, thank you. So thank you both. Oh my gosh, this has been so informative, such great information shared with the audience. Thank you, Charzelle and Dr. Weiss, for taking your time. Was there anything else you wanted to add? Sound like you did. Go ahead.
I did. I just thought of something. I'm so sorry.
It's
Do
okay.
keep in mind it does change. So that's Charzelle, um your intuition that things were getting worse. I want to impress on anybody listening that things can get worse. We as the providers know that we may see you day 1, but by day 4 things are very different. So don't hesitate to come back, call again, go back to the hospital. I definitely, try to give those warning signs to families and return precautions to families, because we do know that these illnesses progress over time. So that was the last thing I wanted to share.
That's actually an excellent point to share this information that we have here tonight. We're going to actually have it available for people to view through Black Health Matters or on YouTube, but also share with your family members and friends, because a lot of times, just like you said, Charzelle, you had never heard of it. Others had never heard of it. You know other parents, or you may have a cousin or family member or church member. We definitely need to get the word out about RSV across the board. I want to thank you again for your time and dedication and being with us tonight. And a thank you to everyone out here who enjoyed this session and received this important information. Your questions and engagement were just very meaningful to all of us. So before we conclude, again, please take a moment to fill out the brief survey here, which will help us to continue to improve our programs and better serve you. And also, I will have a big thank you to our sponsor, Sanofi, as well as the support services provided here. Thanks again for those seeking more information on RSV protection for infants. We encourage you to visit protectagainstrsv.com and also visit our community partners here as well. Once again, thank you for your time and have a good evening and a great holiday season. Thank you. Good night.